Up to 1 in 5 people over the age of 50 are deficient in this vitamin. This leads to deterioration, sometimes irreversible, of the nervous system, cramps, tingling in the hands and feet, instability, clumsiness while walking, along with unimaginable fatigue. And most importantly, your blood tests can appear normal and you could still be suffering from this deficiency. I'm going to explain it to you today. You can also consume enough through your diet and still have a deficiency. I'm going to explain it to you today. There are also 2 drugs, which are widely used that prevent absorption, omeprazole and metformin. Do they sound familiar to you? Yes, that's right. Today we're talking about vitamin B12. I'm Dr. Borja Bandera, a specialist in endocrinology and nutrition. And today, you're going to learn how to detect and effectively treat B12 deficiency, understanding step by step what's happening in your body. B12 is the largest and most complex vitamin we know. It's called cobalamin because it's the only vitamin that has a cobalt ion at its center. And there are different forms, mainly 4. Cyanocobalamin might sound familiar because it's the one you see most often in supplements. It's synthetic and quite stable. Hydroxycobalamin, which is natural, is produced by bacteria and is used in several injectable drugs because of its pharmacokinetics. Methylcobalamin, which is the active form in the cell's cytosol, and 5-deoxyadenosylcobalamin, which is the active form inside the mitochondria. They're all B12 but different forms. Now then, what is it used for? B12 is essential for 2 enzymes to work. Without B12, these 2 enzymes don't function. Methionine synthase, which converts homocysteine into methionine, and methylmalonyl coenzyme A mutase. But don't worry, we're not going to get too biochemical today. What you need to understand is what happens when these 2 enzymes can't function due to a lack of B12, and it actually happens a lot. Pay attention when your body doesn't have enough B12. It doesn't properly synthesize DNA because the synthesis of purine and pyrimidine bases fails, which are the building blocks that make up DNA, so to speak. This causes cells that require very rapid cell replication, like red blood cells in the blood or the cells lining the intestine, to die or be created inefficiently. Let's say the first leads to anemia with immature red blood cells, which are large, that's why it's called megaloblastic anemia, and the second causes digestive issues and inflammation of the mucous membranes. A toxin also accumulates, we can say it's homocysteine, which can't be converted to methionine because the enzyme fails, and therefore it builds up. And this causes toxicity in the cardiovascular and neurological systems, but it also affects the production of myelin. Does that sound familiar? Due to the accumulation of methylmalonic acid and homocysteine, among other things, myelin was that perfect insulator for your nerves, which conduct nerve impulses, and when it fails, the nerves become demyelinated. Do you remember demyelinating diseases? And the impulses are transmitted slowly and erratically, which causes the symptoms you're about to learn about. What do you feel when you're lacking B12? The symptoms and signs that occur when you're lacking this vitamin are of 2 types: hematological, related to the blood, and neurological, related to the nervous system, those related to the blood. Well, they're just like you would imagine in anemia. There's extreme fatigue, you feel short of breath, and your skin and mucous membranes are pale, right? Lab tests, there's what's called macrocytic or megaloblastic anemia, characterized by low hemoglobin, anemia, and a mean corpuscular volume above 100 femtoliters. What this tells us is that those red blood cells are abnormally large. As for the neurological symptoms, as you know, B12 is essential for maintaining myelin. Have I told you what happens when it fails? Well, there are progressive and symmetrical neurological symptoms that, and this is a key point, can occur without significant anemia, okay? Tingling. This is called distal paresthesia in a glove and stocking pattern. Hands and feet, numbness, loss of vibratory or proprioceptive sensation. It's hard for us to know where we are in space. Why? Because the posterior parts of the spinal cord are affected. There is instability when walking, we walk more clumsily, we trip, we fall, and there is a loss of fine motor skills. For example, when writing or buttoning your shirt, there may be shocks or neuropathic pain in some cases, in advanced cases. When we neglect ourselves for a long time, never go to the doctor, don't get blood tests, and have deficiencies. What can happen is what's called subacute combined degeneration of the spinal cord, the worst possible condition resulting from this deficiency, which causes ataxic gait. Hyperreflexia, let's say, a much more complex neurological condition and partially irreversible. Fortunately, it's not common, but other purely digestive symptoms can also appear, such as glossitis, inflammation of the tongue, canker sores, mouth ulcers, and loss of appetite. And finally, accompanying the neurological ones, psychiatric symptoms may appear, such as brain fog, irritability, low mood, depressive symptoms, cognitive slowing, and so on, which can really be confused with another condition, for example, depression, in order to prevent this whole set of horrible symptoms from happening. That vitamin must go from the foods that contain it to your cells, and for that, a complex absorption process must be respected. If you understand how B12 is absorbed, you understand almost everything about this vitamin. Pay attention, look, in the stomach, B12 comes attached to the protein fractions of foods, for example, some clams or a piece of meat. What happens is that in the stomach, gastric acid and pepsin release B12 from those proteins. Immediately, B12, which can't be loose on its own, it binds to haptocorrin, a protein that comes from your saliva, continues down through the stomach and enters the duodenum. In the duodenum, it binds with pancreatic enzymes from the pancreas, which break down the haptocorrin. It becomes free again. But since it's a very dependent vitamin, it has to bind to something else, and it binds to the intrinsic factor of K-cell produced in the parietal cells of the stomach. Although this binding takes place in the duodenum and jejunum, in the most proximal parts of the small intestine, the B12 and intrinsic factor complex continues down and reaches the terminal ileum at the end of the small intestine. There, it binds to specific receptors called the Kuban system and enters the enterocyte of the intestinal cell through one side of the cell and exits into the blood through the other side of the cell. When it leaves the enterocyte and enters the blood, it binds to transcobalamin and forms holotranscobalamin, which is the most usable fraction. This is the active absorption pathway mediated by intrinsic factor, the most well-known one, but there is another very little known passive absorption pathway. This explains why sometimes high oral doses are used, 1000 to 2000 micrograms daily or even more, even when there is an intrinsic factor deficiency. Now I'm going to explain this. Why? Because about 2 to 3% of what is ingested gets through this pathway, and since we don't need much vitamin, that's more than enough for us. And you might say, Borja, nowadays, why could I be lacking vitamin B12? Look, the prevalence of deficiency is high. Up to 20% of people over 60 years old have a deficiency in some studies. That's a lot. And what if in an ideal world, where we all had perfect health and flawless digestive systems, an omnivorous diet shouldn't cause a B12 deficiency, right? But that's not the case. In the West, deficiency due to lack of intake only happens in long-term, non-supplemented vegans or in cases of malnutrition. And it's rare, really. Why? Well, because supplementation in vegan diets is mandatory and very common. A vegan is usually very well informed about this. Be careful with breastfed babies of non-supplemented vegan mothers because irreversible neurological damage can occur in the baby. Aside from this situation, where no animal products are consumed, we have to consider older adults, let's say those over 65 years old. There are two main factors here that affect B12 generally. They follow a poorer diet, with less nutritional density, fewer animal-based foods, and especially, they have it more frequently. Atrophic gastritis is an inflammation of the stomach lining that wears down and becomes thinner. This causes your stomach to produce much less acid and substances necessary to absorb nutrients, such as intrinsic factor. Remember that B12 requires intrinsic factor to be absorbed in the terminal ileum. The stomach is a key part of the digestive system for the absorption of B12, and anything that affects the stomach can cause a B12 deficiency even if you are consuming a sufficient amount. The well-known pernicious anemia is an autoimmune disease in which antibodies destroy the parietal cells that produce intrinsic factor or block the intrinsic factor itself. There is no absorption of B12. Bariatric surgery or gastrectomy. Here, what we're doing is removing part or all of the stomach and therefore the cells that produce intrinsic factor and acid. Remember that acid is necessary to dissociate B12 from animal protein and from haptocorrin in saliva. Metformin, a widely used anti-diabetic drug for chronic use, also reduces absorption by 10 to 30% by interfering with calcium-dependent transport in the ileum. What will happen if you take metformin? It's not that you'll have a B12 deficiency the next day, but you'll have a higher probability of developing it over the years. Is it a vulnerability factor for deficiency? Also, other drugs, so-called gastric protectors, like proton pump inhibitors and H2 blockers, which suppress gastric acid. What happens if gastric acid is suppressed? Well, it prevents the activation of pepsin, which releases B12 from food. And this is interesting. Nitrous oxide, laughing gas, irreversibly oxidizes the cobalt in B12. For it to be functional, it has to be in a reduced state when we inhale laughing gas. What we're doing is temporarily inactivating the B12 reserves in your body. Finally, anything that causes absorption problems in your digestive system will also affect the absorption of B12. Crohn's disease with ileal involvement in the ileum. Remember that untreated celiac disease and small intestinal bacterial overgrowth can affect absorption, since the bacteria in the small intestine consume B12 before you can absorb it. I was telling you we need very little B12 to function, about 2.4 micrograms per day, which increases a bit during pregnancy and breastfeeding, but it's really not much. Lab results range between 200 and 900 pigmol. However, when we have values between 200 and 300, we're talking about functional or subclinical deficiency. And here, in this situation, we need to measure the so-called functional metabolites. Methylmalonic acid, which is also a very sensitive and specific marker of the deficiency. And second, homocysteine. That is, you can have normal B12, but normal levels in the blood and already have symptoms, even neurological symptoms, without anemia. That's why it's important to measure these two things as well, because there may be a patient who doesn't have anemia, who has normal B12, and actually the only thing they have. They are early neurological symptoms which sometimes we don't even pay attention to. And they may have a B12 deficiency that can be corrected, and the patient can completely reverse their symptoms. There's another very important and very common question. Borja, what if my B12 levels are persistently high here? This can happen due to unintentional supplementation or from consuming algae. It can be a marker of liver or hematological conditions, or it could be due to macro B12. They are protein complexes that affect the measurement, but in general, repeat the blood test in a month. When your B12 is elevated, check your supplements, because there are many things we take that contain B12 and we don't realize it. Now, where is B12 found? Naturally, B12 is synthesized exclusively by microorganisms, bacteria, and archaea. You do not synthesize B12. The animal food chain causes animals to store it in their muscles, liver, and bacteria, and then you eat them and ingest it. Plants do not produce B12, they don't need it. Knowing this, it's obvious that it's found in animals, among which the most bioavailable sources are liver, kidneys, clams, mollusks, sardines, salmon, and red meat. Be careful, because many algae contain a pseudo-B12 that is biologically inactive in humans. Also, this is dangerous because it does bind to the transporters, aptocorin, transcobalamin, and they do raise B12 levels in the blood, but they don't correct anemia or prevent neurological damage. In general, with a few exceptions, I don't recommend B12 that comes from algae. What should you look for in your blood test to avoid mistakes? Basically, pay attention and take notes. A blood count measures ferritin and iron. If mixed anemia is suspected, be careful, because here the mean corpuscular volume, which measures the size of red blood cells, can be normal. In microcytic anemia, iron is low, and in macrocytic anemia, it's high. If both iron and B12 are deficient, levels may appear normal. Also measure methylmalonic acid, and homocysteine, which are elevated in B12 deficiency. You especially need to order them when we have borderline levels between 200 and 350 picograms per minute. And also antibodies, anti-intrinsic factor, and antiparietal cell if pernicious anemia is suspected. Now comes the end, which is the solution. How do we solve this? It's good news. The hardest part about B12 deficiency is detecting it in time, because treating it is actually simple. The treatment is to give enough B12 in a sufficient dose and ensure it is bioavailable and reaches the cell properly. For that, we have two options. Give B12 orally or inject B12. Parenteral formulations are usually intramuscular in the gluteus or the thigh. For parenteral formulations, 1000 micrograms of hydroxocobalamin or cyanocobalamin are usually used intramuscularly. What are their drawbacks? It requires healthcare personnel, and you need to go to the health center or the hospital. Nobody likes to be injected. Some people have a psychological aversion to needles, that feeling of being more ill, that perception of seriousness when we have to inject something. It doesn't reproduce normal physiology because it creates physiological peaks above 2000 or even 5000 picograms per milliliter, which then go down, yes, but they create a significant peak. And there can also be some diagnostic confusion because that vitamin B12 can remain very high for months, confusing the doctor. It's reserved for severe deficiencies. For cases with neurological symptoms requiring immediate resolution, therapeutic emergencies, or when the oral route is ineffective for any reason. Then we have the oral route, which is just as effective, really just as effective. In addition, it leads to better adherence and more therapeutic empowerment, because you take it yourself and don't rely on others. Also, as I mentioned, at high oral doses, it can be absorbed well through passive, non-saturable diffusion. Even when you have intrinsic factor problems, you don't produce intrinsic factor, you have atrophic gastritis, you have an ileal disease, or any digestive problem we've mentioned before. Personally, and except for the cases mentioned, I prefer oral formulations like this cyanocobalamin one, which is fast-acting, and with the information from this video, you'll know how to use it with much better judgment than before. Alright, thank you very much for your attention. See you in the next video, a big hug, and let's keep empowering.